passing of Her Majesty Queen Srigit, the Queen Mother, this being the great sorrow to all the Thai citizens, we would like to invite all of you to stand in silence to express the condolences and to reflect on the immeasurable royal benevolence for 1 minute, please. Thank you very much. Please be seated. Sawasdee. A very good morning, dear His Excellency Mr. Masato Otaka, the Ambassador of Japan to Thailand, Dr. Paramaphorn Prasad Thongosut, President and Senior CEO Group 1, Bangkok District Medical Services of BDMS, representative from MEJ, Area, Watanosa Cancer Hospital, distinguished guests, member of the press, a warmest welcome to all of you to the Bangkok Proton Center press conference, the global destination for the next generation of advanced cancer care. As Bangkok Proton Center is advancing modern technology in cancer treatment. My name is Panchi. It's my privilege to accommodate you as your master of ceremony for this morning press conference. Ladies and gentlemen, as we have known that the cancer patient has been increasing every year, not only in Thailand but all around the world. To fight with this disease, we need to find a cutting-edge technology to help the medical personnel to fight with this cancer. The proton technology is another technology with the promise of the S1 and cutting-edge technology that will play a significant role for this cancer fight. Watanosa Cancer Hospital is recognized as the first hospital specialized in cancer treatment, and this hospital is preparing for the Bangkok Proton Center opening. Ladies and gentlemen, this will be another milestone for Bangkok Hospital Group to serve the cancer patient not only in Thailand but all around the world. For a better idea of Watanosa Cancer Hospital to all of you, as well as the progress of the preparation of Bangkok Proton Center opening, we would like to present to you through this video presentation.
At the break of dawn, a new chapter begins, where hope rises with the first light of day. For every cancer patient, hope is more than just a feeling. It is the light they hold on to, the strength that carries them through their healing journey. In moments of vulnerability, we turn inward seeking courage, guidance, and the will to heal. And today, hope is no longer something distant. It becomes something we can finally see. Through the power of advanced science and breakthrough technology, the Bangkok Proton Center was envisioned as a place that embraces innovation to transform hope into reality, where hope meets healing. A proton therapy destination of the future, uniting world-class technology with a patient-centered healing experience. a landmark of precision, powered by proton therapy. We present a new identity for proton therapy.
Soth Cancer Hospital is a specialized cancer hospital under the Bangkok Hospital Group, established in 2006. The hospital was graciously bestowed the auspicious name Watano Soth, meaning progressive medicine, by Her Royal Highness Princess Maha Chakri Sirindorn. Operating under the concept of total cancer care, the hospital provides comprehensive care across all stages, from diagnosis and treatment to rehabilitation, delivered by specialized multidisciplinary teams integrating various forms of advanced innovation and modern medical technology. With experience in treating over 37,000 new cancer patients and guaranteed by international standard awards, Watano Soth Cancer Hospital is committed to continuous development by collaborating with leading medical institutions worldwide. And we are committed to advancing cancer care with next-generation technologies, bringing hope to patients around the world. Bangkok Proton Center, global destination for the next generation of advanced cancer care. Most recently, we've partnered with MEJ and ERIA to revolutionize cancer treatment by leveraging the precision of proton therapy, the cutting-edge standard in oncologic radiation. We aim to become a leading cancer center in Asia. Our Proton Center features the following key benefits: reduced side effects, better protection of healthy tissues, reduces the risk of recurrence, suitable for elderly patients, effective for hard-to-treat cancers, to bring hope and a better quality of life to cancer patients. The new dimension of cancer care. Coming soon in 2029, Bangkok Proton Center.
All right, ladies and gentlemen. Thank you. To kickstart today's press conference, I would like to invite Dr. Paramaphorn Prasad Osot, President and Senior CEO Group 1, Bangkok Medical Services or BDMS, to the podium to deliver her welcome remark and details on Bangkok Proton Center opening preparation as well as the academic support. Please kindly join me to welcome her to the podium.
His Excellency Mr. Otaka Masato, Ambassador of Japan to Thailand, Dr. Manami Ueki, Director of Health Services in the Economic Research Institute for ASEAN and East Asia, Dr. Kenji Shibuya, Chief Executive Officer, Medical Excellence Japan, member of the media, distinguished guests, ladies and gentlemen, on behalf of the Executive Management of Bangkok Medical Services Public Company Limited, or BDMS, it is an honor to reaffirm our unwavering commitment to advancing cancer care. Cancer remains the leading cause of death worldwide and one of the most critical health challenges in Thailand. As the incidence and mortality rates continue to rise each year, BDMS is more determined than ever to ensure that our patients receive care that is safe, precise, and truly world-class. Today marks a defining moment in this mission. It is with great pride that we announce the development of Thailand's first proton therapy center in the private healthcare sector, which is scheduled to begin providing services in 2019. This initiative represents a transformative leap forward for cancer treatment in our country. Proton therapy is not simply an advanced technology. It is a breakthrough approach that delivers exceptional precision, minimize damage to healthy tissues, reduce long-term side effects, and significantly improve outcome, especially for complex cases and for children who require the gentlest and most effective treatment possible. At BDMS, we firmly believe that the future of cancer care must be shaped by innovation, compassion, and the courage to lead. Our vision is to help Thailand step into a new era of oncology, one in which cancer patients can access advanced treatment in all aspects, including genomics, robotic surgeries, and proton therapy, where the highest standard of care is available right here. We extend our deepest appreciation to IRIA and MEJ for their trust and strategic collaborations, and to the government of Japan for their invaluable support. Your partnership strengthened our resolve to build the Bangkok Proton Center into a center of excellence that meet the highest international standards. Lastly, we sincerely thank all partners who share this vision with us. We truly believe that the Bangkok Proton Center will become a beacon of hope, empowering patients and families to face cancer with confidence, resilience, and renewed possibility for a healthy and fulfilling life. Thank you.
Thank you very much, Dr. Paramaporn, for your warm welcome and for the sharing of the advancement technology of cancer treatment. Up next, ladies and gentlemen, I would like to invite His Excellency Mr. Masato Otaka, the Ambassador of Japan to Thailand, to deliver his congratulatory remarks on the collaboration between Thailand and Japan in supporting the Bangkok Proton Center. Otaka, Taichi-sama, yoroshiku onegaishimasu.
Before I begin, I would once again like to express my sincere condolences to the people of Thailand for the passing of Queen Sirikit. And I wish her spirit will rest in peace. Dr. Paramaporn Prasaton Osot, President of and Senior CEO Group, Bangkok Medical Services, Visiting Professor Dr. Tirawut Kub Prima, Hospital Director of Watana South Cancer Hospital, Dr. Manami Uechi, Director of Health Services, the Economic Research Institute area, Dr. Kenji Shibuya, Chief Executive Officer, Medical Excellence Japan, distinguished guests, members of the media, and everybody. Good morning. It's a great honor for me to be here, and as all of you know, Bangkok Hospital is a familiar and important place for us Japanese in particular living in Thailand. And Bangkok Hospital has Japan Medical Services, a clinic dedicated to Japanese clients, and established in 1977 by Thai people who graduated from a Japanese medical school, such as Dr. Tirawut. Their medical coordinators who speak Japanese are also stationed providing medical services in Japanese and in comprehensively supporting the health of tens of thousands of Japanese residents in Thailand. So once again, I would like to express my gratitude for the daily support from everyone at this Bangkok Hospital. Today, a new page in history of friendship between Bangkok Hospital and Japan has been marked. Proton beam therapy device made in Japan is to be installed at Bangkok Hospital. And congratulations to all this. And this will be the first case for a private hospital in Thailand as well. In Thailand, like our country, Japan, the population is aging, and with the diversification of diet and lifestyle, cancer is becoming one of the familiar diseases for people here as well. I personally have been involved. I lost my wife 5 years ago to pancreatic cancer, which is very hard to detect at an early stage, and there's really not many options for cure. And I think the patients and the families of the patients sincerely hope that there will be progress in the cure of cancer. And the patients and the families never give up until the very last moment. And I hope all the people who are involved in the improvement and progress in the cure will also never give up as well. On the other hand, side effects are rather serious. I think in most cases, chemotherapy is applied. And that was the case with my wife as well. But I have to admit that it does affect your lifestyle quite a bit. And people are having second thoughts about whether to receive chemotherapy or not. And this is a very hard decision to make for many people as well. But we do believe that with appropriate treatment, perhaps proton can be an answer. It's possible to lead a close to normal life even after you're affected. And we are actually, in that sense, pleased that this introduction of a proton beam therapy will support the health of many Thai people and give more options to the people affected and the families affected as well. However, simply introducing medical services can be a waste if not used properly, and the development of a medical personnel who can handle this appropriately and the exchange of knowledge are also critical. And therefore, today, Medical Excellence Japan, MEJ, the Economic Research Institute for ASEAN and East Asia area, and Bangkok Hospital will sign an MOU. And it's expected that through the exchange of knowledge and among the medical professionals from both countries, the citizens of both countries will have access to highly qualified medical services. Cooperation between Japan and Thailand in health and medical services began with the construction of National Institute of Health in 1962. And since then, various collaborations have been done, including the development of medical human resources, support for the establishment of Thailand's universal health coverage in 2002, and the provision of vaccines during the COVID-19 pandemic in 2020 as well. The introduction of this proton beam therapy device and the signing of MOU today will take the cooperation between Thailand and Japan to another level. And I hope that this historic day will further deepen the friendship between the two countries and provide more viable options to the patients as well. Thank you so much.
Ladies and gentlemen, next we are honored to invite visiting Professor Dr. Thirawut Kuhaprema, Hospital Director of Proton Cancer Hospital, to share with us on the establishment of Bangkok Proton Center to serve the cancer patients both in Thailand and internationally, as well as the collaboration between Thailand and Japan. Please.
His Excellency Mr. Otaka Masato, Ambassador of Japan to Thailand, Dr. Paramaphorn Prasathong, President and Senior CEO, Group 1, BDMS, Dr. Kenji Shibuya, Chief Executive Officer, Medical Excellence Japan, MEJ, Dr. Manami Uechi, Director of Health Services, Economic Research Institute for ASEAN and East Asia area, Dr. Yuta Sekino, National Cancer Center, Japan, members of media, distinguished guests, colleagues and friends. It is an honor to speak on behalf of Proton Cancer Hospital on this special day. Since our founding Proton Cancer Hospital in 2005, Proton Cancer Hospital, a specialized faculty within Bangkok Hospital headquarters, operated under Bangkok Medical Services, so-called BDMS, has been dedicated to providing integrated patient-centered cancer care, supported by advanced technology and expertise of our multidisciplinary team. Each year, we treat more than 3,000 new cancer cases at our hospital and allow 60% of our patients come from overseas. The introduction of proton therapy represents a major milestone in our mission to provide world-class cancer care. Unlike conventional X-ray radiation, proton beams can be delivered with extraordinary precision, allowing oncologists to treat or target tumors with millimeter level accuracy. This precision minimizes exposure to surrounding healthy tissues and critical organs, reducing the side effect and improving the inpatient quality of life during treatment and after that. Proton therapy is especially beneficial for complex and hard-to-reach tumors, pediatric cancer, and cases where conventional radiation may carry high risk. By bringing this cutting-edge technology to our hospital, we are taking a significant step toward offering our patients the safest, most advanced, and most effective cancer treatment available today. Japan is recognized as a global leader in proton therapy, with over 20 operational centers in Japan and decades of clinical experiences. We are proud to partner with Sumitomo Heavy Industries, a well-known Japanese company with a long-standing reputation in proton therapy. They are providing with next-generation proton system to us, which is more compact and more efficient, enabling us to deliver advanced treatment here in Thailand. Today marks the beginning of our cooperation with two leading Japanese organizations, IRIA and MEJ. As we prepare our proton therapy center, scheduled to commence operation in 2029, between now and then, we will focus on many critical activities, including facility design, construction, system installation, and most importantly, the training and preparation of our medical teams to deliver the best advanced proton therapy service in Thailand and around the world. At Proton Cancer Hospital, we are committed to bringing the latest technology and highest standards of care to our patients, living by our motto, care beyond cure. Thank you very much.
Thank you very much, visiting Professor Dr. Terwood, for your sharing. Ladies and gentlemen, we would like to acknowledge another partner supporting in this project. At this moment, we are honored to invite Dr. Kenji Shibuya, Chief Executive Officer of Medical Excellence Japan, or MEJ, to share with us regarding the support of the knowledge exchange and operations of the Bangkok Proton Center to ensure the internal standards. Shibuya Sensei, yoroshiku onegaishimasu.
Sawadee Your Excellencies, Ambassador Otaka, Dr. Pramapon, Mr. Kazuha, Dr. Martini, and Dr. Tirarut, distinguished guests, colleagues, and ladies and gentlemen, Good morning, and thank you very much for joining us today. Today marks a very important milestone in Japan-Thailand collaboration. We come together not only to sign an MOU, but to strengthen our shared mission to provide the highest standard of cancer care for our people. As Dr. Pramapon mentioned, cancer remains one of the most challenging diseases of our time. Yet it is in cancer care that innovation and international partnership can create the greatest impact. And healthcare is no longer just a social service. It is a foundation of national strength, economic security, and long-term prosperity. Advanced technology like proton beam therapy, AI diagnostics, and precision oncology are essential to building resilient societies. Both Japan and Thailand recognize the importance of investing in high-quality cancer care as well as human resource development. Japan has developed a comprehensive cancer control system, starting from our national capacity for cancer prevention, population-based screening, early detection and treatment, and that is among the best in the world. And as you know, Japan has achieved world-leading survival outcomes across multiple cancer types, including liver, colorectal, gastric, esophageal, lung, breast, and pediatric cancers. These achievements are the result of meticulous medical training, multidisciplinary care, and continuous quality improvements across the nation. And we are keen to share these practices from prevention and early detection protocols to surgical workflows, quality control, and survivorship programs with our Thai colleagues so that more patients benefit from earlier diagnosis, less invasive treatment, and better recovery, which definitely boosts the BDMS reputation in the future of cancer care across the globe. I strongly hope that Thailand, through the BDMS Cancer Center, should become the global hub of cancer care ecosystems. As Medical Excellence Japan, we serve as a platform uniting government, industry, academia with medical institutions to deliver Japan's healthcare excellence globally. The MA Thailand initiative was established to deepen collaboration between Japanese and Thai partners, including BDMS. And BDMS is one of Asia's most advanced medical groups. And its commitment to oncology excellence makes it an ideal partner for the next phase of collaboration. Proton beam therapy represents one of Japanese signature technologies. But technology alone is not enough. Japan has more than 2 decades of clinical experience as well as more than 2 operating systems in proton beam therapy. Together with BDMS and Thai institution, we aim to build a true ecosystem of co-creation, combining proton therapy and other technology with medical training, standard clinical protocol, safety and quality systems, research collaboration, and comprehensive survivorship programs. Ultimately, it is the people, physicians, nurses, medical physicists, engineers, researchers, presenting today in this room, who will bring this partnership to life. This MOU is not just a formal agreement, it is a commitment to better prevention, early diagnosis, safer surgical care, more precise radiotherapy, and lifelong support of survivorship. Ladies and gentlemen, let us seize the moment to accelerate our cooperation to build bridges of trust, innovation, and shared prosperity. It would, in a world that feels increasingly uncertain and unpredictable, the trust-based collaboration between Japan and Thailand has never been more important. So together with BDMS, let us build a new model of cancer care for the region, one that is advanced, compassionate, and sustainable, a model that reflects the very best of Japan and Thailand working side by side. Thank you very much.
Shibuya Sensei, arigatou gozaimashita. According to Dr. Shibuya's speech, it's quite impressive for the survival rate of the cancer patient in Japan, and we hope in Thailand we will accelerate the treatment level into international level as well. Up next, we are honored to invite Dr. Manami Ueji, Director of Health Services, the Economic Research Institute for ASEAN and East Asia, or ERIA, to share with us on the research and development collaboration for Bangkok Proton Center aimed at advancing medical technology. Ueji Sensei, yoroshiku onegai itashimasu.
Thank you very much for the kind introduction. Dr. Poramapong Prasaton also, President and Senior CEO, Group 1, Bangkok Dusit Medical Services, BDMS. Dr. Tirawut Kuhaprema, Hospital Director of Watanosov Cancer Hospital. Dr. Martine Manipan, CEO, Group 1 and Hospital Director of Bangkok Hospital. His Excellency, Mr. Masato Otaka, the Ambassador of Japan to the Kingdom of Thailand. Dr. Kenji Shibuya, CEO of Medical Excellence Japan. Distinguished guests, ladies and gentlemen, very good morning once again to all of you. Again, my name is Manami Uechi, and I'm the Director of the Healthcare Unit at the Economic Research Institute for ASEAN and East Asia, or AREA. On behalf of AREA's President, Tetsuya Watanabe, I'd like to express my sincere gratitude to Dr. Paramapong Prasato also and Dr. Tirawut Kuhaprema for their shared vision and continued partnership. I'd like to also extend my appreciation to Dr. Kenji Shibuya and the delegation of MEJ for their invaluable work, dedication, and support in making this event possible. Today, I am profoundly grateful to all the distinguished participants for joining this unique opportunity of mutual learning and knowledge sharing that focuses on cross-border collaborations and partnerships in the medical and healthcare sectors. AREA is an international research organization and policy think tank headquartered in Jakarta, Indonesia. We work closely with the ASEAN Secretariat, government agencies, and research institutions across Asia Pacific to provide innovative and analytical research and policy recommendations. Over the past few years, in partnership with the government of Japan and MEJ, AREA has been fostering a unique multi-sectoral and action-driven initiative called Medical Excellence in Asia. We are immensely grateful and delighted to be part of this special occasion to celebrate the commencement of our strategic collaboration to enhance and strengthen healthcare systems and services in the region, particularly through public-private partnerships with the primary focus on people's health and well-being. Proton therapy represents a transformative leap in cancer care, offering non-invasive, highly targeted radiation that spares healthy tissues and results in fewer side effects, particularly beneficial for older and pediatric patients and protecting critical organs. AREA is proud to champion this innovation in Southeast Asia through a unique partnership with MEJ and BDMS, combining Japan's advanced technology, BDMS's clinical excellence, and AREA's policy leadership. For Thailand, where cancer burdens are rising along with a rapid demographic shift, this therapy promises better health outcomes and quality of life. Furthermore, this initiative is more than science and technology. It is a milestone in Japan-Thailand healthcare cooperation and a blueprint for ASEAN-wide scaling under the Medical Excellence in Asia framework. Our role is to bridge research, policy, and implementation, ensuring that medical technology like proton therapy advance our broader vision of sustainable and inclusive healthcare systems for an aging Asia. AREA believes that healthcare is an opportunity for growth and inspiring innovations. We envision a world in which all people will be able to gain access to safe, effective, and quality healthcare services and ultimately improve their livelihood. I sincerely hope today's MOU signing ceremony will be a stepping stone toward a healthier future and robust healthcare industry development in Thailand, Japan, ASEAN region, and beyond. Once again, my heartfelt thanks to BDMS, Bangkok Cancer Hospital, MEJ, and all distinguished guests and participants for your partnership, shared vision, and commitment to this meaningful agenda. Thank you very much for your kind attention.
Sensei, arigatou gozaimashita. Ladies and gentlemen, we are proceeding into the highlight of this morning press conference. We are going to proceed into the signing of Memorandum of Understanding for both countries, Thailand and Japan. This would be another milestone for the cancer treatment in Thailand, ladies and gentlemen. We're not playing only the role domestically, but also internationally as well, with a safer treatment and with the cutting-edge technology as well. Thank you very much for all the partners and all the parties participated in this project. We are expecting the 2029 to come, and we will see this Bangkok Proton Center becoming in reality. And I would like to invite the signees of this MOU. Please kindly proceed up on stage accordingly. I would like to invite Dr. Methini Maitam, CEO of Bangkok Hospital, Visiting Professor Dr. Thiravuth Prema, Hospital Director of Bangkok Cancer Hospital, Dr. Kenji Shibuya, Chief Executive Officer, Medical Excellence Japan, or MEJ, Dr. Manami Ueji, Director of Health Services, the Economic Research Institute for ASEAN and East Asia, or ERIM. Ladies and gentlemen, at the moment, the four signees are already on the stage, and we would like to place the folder for each country. Each country will receive one folder that will obtain 2 signatures from each signee. Please. Ladies and gentlemen, as we acknowledge and we realize that the cancer has taken away many of the family loved ones, and the numbers of the patients of the cancer suffering because of the cancer are increasing every year. This would be another significant collaboration between both countries that will accelerate people living life and to fight with the disease. I am thrilled and I cannot wait to see this Bangkok Proton Center becoming real in 2029. But eventually, this center is supposed to be very magnificent. And of course, we can serve the cancer patients all around the world. And this could be another economic stimulations in Thailand as well, ladies and gentlemen. Alright, are we good? At this moment, I would like the 4 signees, could you please be upstanding for the group photo section, please? And the 2 signees standing in the center, could you please show the photo with the close photo, please? With the close photo, please. Close photo. Thank you very much. And now it's time for the photo opportunity, ladies and gentlemen. Alright, so now we have the media press members joining us this morning, so please kindly look at the sign, the hand sign from the cameraman. We will have another 2 shots of the photo opportunity. Alright, are we good? Thank you very much. I would like to invite the 4 signees. Could you please remain on the stage? Could you please remain on stage? And please proceed to the front stage, please, for another photo opportunity. And I would like to invite more of our guests to join in this photo section, please. I would like to invite Dr. Poramaphon Prasad Thong Osot, President and Senior CEO Group 1 from BDMS. I would like to invite His Excellency Mr. Oraka Masato, the Ambassador of Japan to Thailand. Please kindly join us for the group photo section. Mr. Chayapon Prabha, Representative of Medical Excellence Thailand. Mr. Toshikatsu Hiyasa, Division Director, Industrial Equipment Division, Sumitomo Heavy Industries Limited. Please kindly join us for the group photo in this section, please. Alright, we will have the media press camera as well. Could you please stand in closer together? Thank you very much. Alright, are we good? We have another photo opportunity section waiting us. I would like to request all distinguished guests on stage. I would like to request all distinguished guests on stage. Could you please remain on the stage? Could you please remain on the stage as we will invite another of our honor guests. First, I would like to invite Mr. Ichiro Abe, President Japan External Trade Organization or JETRO. Kindly join us for the group photo section. And Ms. Makimo Tagiri, Deputy Director of Healthcare Industry Division, Commerce and Service Industry Policy Group from Ministry of Trade and Industry. And now we still like to request all the guests on the stage. Could you please remain on the stage first? You may remain on the stage first.